So we will be going over the Honduras Health Status Report. Honduras is located in Central America. They have a tropical climate with the average temperature of 86 degrees Fahrenheit. With the tropical climate comes a rainy season that takes place during the months of June through October and the rest of the months having drought. The predominant language spoken in Honduras is Spanish, but English is spoken around the northern islands. 90% of the population is mestizo, with small minorities of European, African, Asian, and Arabian. 60% of the population lives in poverty, and 72% of the population depend on agriculture for their income. According to the World Bank, Honduras is considered a lower middle income country. This means they have a salary of $1,086 to $4,225. The life expectancy in Honduras is 71 years old, and the infant mortality rate is 14 per 1,000. The disability adjusted life year, also known as DALY, is the sum of years lost due to premature mortality in the years lived with a disability. Honduras's top DALY is interpersonal violence. This violence can be caused by domestic abuse and the violence from the cartel that has ran Honduras. Hondurans love to party and have festivals. They have a huge drinking culture. The high amounts of alcohol consumed by the citizens is a high-risk behavior. It is a high risk because people become impaired and hurt themselves, and the long-term effect on their health can cause them to experience other diseases like cirrhosis of the liver and kidney failure. 3.3 million people are affected by food insecurity in Honduras. This is because the population depends on using their own resources to feed themselves because they cannot afford to buy their own food from a store. There is an insecurity because with the tropical climate comes extreme rain that can wash their farms away and extreme droughts that can cause the vegetables and fruits to not grow. Honduras' health system is made up of private and public sectors. Private sectors are owned, controlled, and managed by individuals, groups, or businesses. Public sectors are owned, controlled, and managed by the government. The main public sector in Honduras is Ministry of Health, and they serve majority of the population. The citizens pay into the government fund through their paychecks for the Ministry of Health, and when they need health services, they do not have to pay. The private sector is made up of non-profit organizations and for-profit organizations. Healthcare access is determined by the poverty level and the environment. If someone is wealthy, they have easier access to healthcare, while the poverty-stricken communities do not have easy access or access at all. The environment also matters. The urban areas, which are usually more wealthy, have easy access to healthcare, whereas the rural areas, which are usually poverty-stricken, do not have easy access or access at all. 18% of the population in Honduras cannot access healthcare. There is also a shortage of physicians in Honduras. There are only 0.37 physicians per 1,000 people. This also causes healthcare that is not easily accessible. When comparing Honduras to the United States, the economy is the biggest difference. As stated before, Honduras has a lower middle economy. The United States is considered a high-income economy. The average monthly income in Honduras is $600, while the average income in the United States is $4,000. Honduras is also self-sustained, meaning they grow their own food and use their own natural resources for their needs, whereas the United States outsources most of our food and natural resources for all of the U.S. needs. Honduras also cannot drink their water like the U.S. can. Honduras's water is filled with bacteria. The water has to be filtered to be safe to drink, and a lot of Honduras's water comes in plastic bags. My recommendation for improving the health is to open opportunities for citizens to escape poverty. This will allow citizens to make more money, which in turn will improve the public health. The citizens will be able to afford supplies that can prevent diseases and afford to be able to access medical facilities. When the public can afford medical care, it will increase revenues in the healthcare realm, which will increase the number of physicians and medical facilities. With the increased revenue in healthcare, organizations can offer monetary initiatives to bring in physicians from other countries and or provide education to their citizens to become physicians. The increased amount of physicians will make healthcare more accessible. The government also needs to start decreasing violence caused by the cartel. This will be extremely hard due to the cartel being embedded in the government. These violences caused by the cartel has made Honduras extremely dangerous and has been the highest DALY for Honduras. I interviewed Aaron Parker, who lived in Honduras for a year while working for the U.S. government. While in Honduras, he did not have any experiences with the extreme poverty communities due to the U.S. base being surrounded by the more wealthy population. Aaron stated that Hondurans are extremely humble, even though they are surrounded by poverty. He also stated that Hondurans love to party and that their celebrations are the best he ever attended. They were filled with laughter, smiles, and drinks. He also stated that Honduras is very self-sustained. They use their own natural resources to keep themselves up and the community up. The average salary is $600, but food from grocery stores are the same price as the U.S. This is why Hondurans need to harvest their own food and herd their own animals for food. The water is filled with bacteria, so they cannot drink their own water. Aaron stated that the water is provided in plastic bags. He also stated that he never seen any domestic violence and that women are treated with the most respect. Aaron said that the violence comes from the cartel members and that the safety is not important in Honduras. When going anywhere, you have to be hyper aware of your surroundings and move with caution. He said that the cartel is embedded in the government and that is why nothing is being done to stop them. In conclusion, even with Honduras having extreme poverty, Hondurans are humble and live life to the fullest. Poverty has the hugest impact on the public health. Citizens do not have easy access to healthcare and food. This causes diseases that could have been prevented. The culture of Honduras also has an impact of their health. With heavy drinking and partying comes diseases and deaths that could have been prevented. As well as the cartel has had the biggest impact on the deaths and injuries caused to the citizens.